Hello, everyone, and welcome to the 50 Days DNA Health and Wellness Challenge here at African Ancestry Link. Today, we're speaking with Dr. Annerin Maxwell. Welcome.
Oh, thank you. Thank you for having me. Hi, everyone. I am Dr. Annerin Maxwell, and welcome to Genetic Awareness Week of the 50-Day DNA Health and Wellness Challenge. This week, we're focusing on early detection saves lives, how genetic awareness help prevent common diseases. So we're exploring screenings, family history, and connection between genetics and lifestyle. So, understanding what runs in our bloodline empowers us to take actions early and make informed choices for your long-term health. I'll be sharing practical insights to help you better understand genetic risk and how awareness can support prevention. If you haven't registered yet, this is your sign to join the 50-day Health and Wellness Challenge with the African Ancestry Link. Join us and take a step forward protecting your health and your future.
Thank you for that, and thank you for being here and speaking with us today. It's awesome to have you. Thank you for your
Thank
support.
you.
So I'm going to jump right into it. When we hear the phrase early detection saves lives, we hear that all the time. But what does that actually mean in like everyday common terms?
Yeah, sure. So early detection often means identifying health risks or diseases before symptoms become severe or the disease develops at all. So many chronic diseases and conditions like hypertension, diabetes, kidney disease, and certain cancers, they develop silently. So when we catch them early, we can often prevent like complications and slow the progression of these conditions. So early detection gives people more control, more options, so and better outcomes like overall.
Well, yeah, that makes sense. You know, you catch it early, it becomes easier to do something about it.
Mhm.
Um, so how would you say that genetic awareness fits into that early detection?
Yeah,
Is-
that's a great question. So with genetic awareness, so helps us to helps us understand what we are predisposed to based on our family history. So genetics doesn't have to they don't our genes do not have to determine our destiny, but they influence one's risk of developing certain conditions. So knowing that risk allows healthcare providers and the person involved to recommend earlier and more frequent screenings and to have more personalized prevention strategies. So, as I previously mentioned, early, like giving people more control, more options, so better outcomes overall.
Okay, so you know, it's never hurts to be informed, and in this case, it helps to be informed to have more knowledge about your own personal history. You know, it's your life at the end of the day.
Mhm.
Now, you mentioned family history. How important is family history in terms of disease risk, or is it all just you know my father had it, my grandfather had it, or how would you frame that?
So it's extremely important to kind of know your family history. So if close relatives like parents, siblings, grandparents is mainly what we're kind of looking at, have conditions like heart disease, diabetes, breast cancer, colon cancer, sickle cell disease, or hypertension, that information can significantly change how we approach screenings and prevention, whether you have to start your screenings like at a time when the general population starts or at an earlier like time frame, so that really helps you to kind of have a better control and be able to be proactive about your healthcare overall.
Okay. Now I hear this emphasis on knowing more about your family history and your genetic risk. But what is actually important? You know, how much do we actually need to know about our family risk?
So some of the important things that you can find out about the family history is that mainly what conditions run in the family, who had them. So if it's your father, mother, grandparents, who had these conditions, the age that they were diagnosed, whether it was an early diagnosis or whether it was early in the sense like in their late 20s or 30s, 40s, or if it was diagnosed sometime in their late 60s or 70s, and any major complications that the family members had associated with that disease is something that's kind of important to know. That way you can find out what kind of prevention, what kind of screenings that you need to have.
Now, I hear you talking about it, you know, like it's easy to, you know, get that kind of
Mhm.
information, but I know a lot of families, mine included, and a lot of the people, a lot of my friends and coworkers, we don't really talk about our family history. Our family doesn't really talk about health. So what would you say to those families and those individuals who are dealing with those situations?
Yeah, that's actually very common, especially in communities where there can be issues with like having medical mistrust or there's stigmas involved. If you don't know your family history, that's actually more reason to be more proactive with like routine screenings that are available. And when possible, if that's something that you are able to do, start the conversation now. And what you learn today can protect future generations.
Okay, okay. Now, you mentioned the term screenings. You hear that every once in a while in the media or, when you stop past the clinic, but what exactly are screenings?
So screenings are usually tests done when a person is usually feeling healthy before any symptoms. So to catch the disease early. And diagnoses are usually done after you have certain, like symptoms or something else that comes up and any complications. But screenings are done usually when a person is healthy, so that we can, kind of detect any conditions or any diseases early on.
Okay, so it's really being proactive, and what I'm hearing is, getting ahead of it. But how will we
Exactly.
know when to go? Like you said, it's like when we don't have any symptoms. So I guess the question is, what are some key screenings that we should be aware of? And I guess what are the intervals in which we should go get those?
Yeah, so some of these routine ones that anyone, like most of it's like a routine kind of screenings that are available to everyone. So for example, like for blood pressure, also known as hypertension, high blood pressure is a major risk factor for having like major risk factor for heart disease, stroke, kidney disease. So anyone over the age of adults, over the age of 18, at least once a year and more often, if your readings are elevated, if the blood pressure numbers are elevated, or if their risk factors are present, for example, family history, obesity, or diabetes. So this is mainly for blood pressure. Anyone over the age of 18 and at least once a year is what's recommended. And for blood sugar, so or more of a test for done for that is the hemoglobin A1C, and which is measured for the last 3 months, like your sugar levels. And this is done for pre-diabetes and to screen for diabetes and pre-diabetes. So anyone adults of the age of 35 to 70 with a BMI of, so body mass index of more than 25 and earlier, and more often if there's family history and gestational diabetes or high risk like ancestry, any high risk that runs in your family or that you know in the society, and how often you have to do this every 3 years if it's normal, and more frequently if the person is pre-diabetic or risk factors are present. So some of the things that you have to kind of watch for is that the A1C level, it should remain less than 5.7 is considered as normal, and anything between 5.7 to 6.4 is considered pre-diabetic. And if you are in this range, you might require more of a frequent screening than those with the normal screening level. And anything over 6.5 is considered as a diabetic. And that will require further, like treatments and more of other screenings as well. And for cholesterol is another one that's recommended for adults. So anyone over the age of 20 should have like a baseline test. So, and how often do you want this to be done? It's every 4 to 6 years if the risks are low. And if there is like a family history, so this is where that family history and knowing your family, background, family's health matters. So if there's like a family history, you of heart disease, diabetes, high blood pressure, or smoking, you that kind of frequency and that level of, like screening kind of changes, right? And then so we're looking for something like a total cholesterol, LDL, often referred to as like the bad cholesterol, HDL, so triglycerides. These are the levels that's usually commonly tested for patients. And there are other screenings done as well. So for example, for many cancers, there are screenings available in right now, and for breast cancer, cervical cancer, prostate cancer, and colorectal Cancer. So for breast cancer screening, the guidelines are from ages 40 to 74 for women, and every 2 years is the recommended. And the other cancer where there's a screening available is the cervical cancer screening, again for women ages 21 and onwards for every 3 years, or from age 30 onwards with an HPV test every 5 years. So this is usually after 65. If the screenings have been normal, that's when the screening usually ends for cervical cancer. And with the WHO, this is one of that unique cancer where there is a vaccination available and it's highly recommended. So if you're between the ages of 9 and 14, 1 or 2 doses are scheduled for girls. And if you're between the ages of 15 to 20, 1 or 2 doses are scheduled for girls and women, and 2 doses with 6 month interval if anyone older than 21. So a minimum of 2 doses are required. And when necessary, so those with immunocompromised or with HIV infected patients, they usually go into having 3 doses are recommended for those patients. And the other screening, one of the leading causes of cancer deaths in the United States currently is in colorectal cancer. So the age recently has been dropped from 50 to 45. And so they recommend screening for adults over the age of 45 and older. And that's the standard colonoscopy, screening that's recommended. And it's recommended for every 10 years if normal. But if not, the screenings and the recommendation interval changes. And especially if you have family history or genetic syndromes, you might have to start these screenings early. So this is where that individual, family history again comes into play. And then this is something you need to be aware of. So discussions with your healthcare provider and see if this is something that you need to start now or if something that needs to be done in the future. So these are things to be aware of. And prostate cancer screening is another one. So for prostate cancer, it's usually screening between the ages of 55 to 69. And this is on an individual basis, and patients and clinicians should consider, like based on the family history, whether, balance of the benefits as well. And on an individual basis is like usually when the screening is done. There are other screenings available for other conditions as well. So for kidney disease, you're screening for like any chronic kidney disease. So you're looking for something like blood urea nitrogen, urine albumin, any adults with diabetes, high blood pressure, or heart disease. So it's like a baseline levels that you're looking for. And there are other conditions as well. So you have like mainly talking about genetics, carrier screening, inherited conditions that can be passed down, like to the next generation. So, for example, sickle cell disease, thalassemia. So, thalassemia is usually seen in the people of Mediterranean, Middle Eastern, African, and Southeast Asian descent. Um, there are screenings available for these conditions, especially those who are planning to become pregnant, any family planning. There are genetic, testing available. You can discuss with like your provider to get a more personalized screening or more personalized test and advice for that. And BRCA1 and BRCA2 mutations, these are associated with certain cancers. So for mainly breast cancer, ovarian, prostate, and pancreatic. And anybody with a strong family history of breast or ovarian cancer, or cancers at young age, multiple relatives with the related cancers, should have this discussion with the healthcare provider. And there are certain conditions where there is families are predisposed to high cholesterol, like very high cholesterol level from birth. So like in a condition called familial hypercholesterolemia. So why this is an important thing to kind of have a discussion is because when you have this level that's very elevated or very high, this can lead to early heart disease, heart attack. So it's very important to have these levels checked, and that way you can take better control and have better healthcare outcomes. So, and then another condition is hereditary hemochromatosis, which is where there's an iron overload. And what kind of screening that we can do is the HFE gene testing. So why this is important? Because of this overload of iron, it can damage the liver, the heart, and pancreas if left untreated. So there are treatments available, there are screenings available. So prevention being like one of the one of the things that we can all do. It's really important to kind of have these discussions with your healthcare provider. That way you can take better control and have greater quality of life mainly.
Wow. Well, thank you for that. I mean,
I know a
that
lot
was
of
very informative.
information. Yeah.
But I know I was sitting here like I didn't even know about, for example, the that there was a vaccine for cancer or for one of the cancers you spoke. I think it
Mhm.
was cervical cancer, I believe it was. I was
Yes.
like, wait, a
Mhm.
vaccine for cancer? And then you spoke about hypercholesterolemia, something of that.
Mhm.
I never heard of that. And this was very informative. And we'll be sure to try to get these materials out to you guys during the week so you can really hone down in on some of these things and what to be aware of and when to go screen. You're like, oh wait, I should probably go get this screening or that screening. I know I
Mhm.
was sitting here taking mental notes as you were going down the list. Like, okay, I'm good on that. I'm not good on that. I'm good on
Mhm.
that. I'm not good on that.
Yeah.
And I think what something we can all take away from this, hopefully our viewers and our listeners will take away is that there's something for everyone. I don't think
Yes.
many people will listen to this and be like, oh, that doesn't apply to me. That doesn't apply to me. Something on this
Mhm.
list probably applies to you or your family history. And
Mhm.
so, I mean, that's I really appreciate it. And it really just highlights the importance of being like aware, having that knowledge.
Exactly. Yes. Mhm.
When you talk about the connection between genetics and lifestyle, I hear you talking about, going to go get screenings or being aware of your
Mhm.
family history. But what about like the way we live, like our daily habits? How do they work together?
So genetics sets the baseline risk, but your lifestyle plays a huge role in whether the risk turns into a disease. So for example, diet, physical activity, stress, sleep, smoking, and access to healthcare, like all influence how these genes are expressed in a person. And that's very important to kind of have an understanding. So your lifestyle really plays a huge role in how like things are shaped, like how things will be expressed later on in life.
Okay. Now, when you say that, I know me a little bit, got a little bit of anxiety. I'm like, oh man, I have, this
Mhm.
genetic risk and maybe I, drink too much sodas this month. For all the people out there listening who might want to have some ease of mind, what are some realistic things that people can do to kind of change and improve their lifestyle habits?
Yeah, so realistically, we're looking for what it is that more of a consistency rather than a perfection in life, So moving your body regularly, walking, like that's something like a lot of, like we can do on a regular basis, eating more whole foods and fewer ultra processed food, and managing stress, having a good sleep routine, prioritizing sleep, and staying consistent with medical care also is very important. And these are things that are very practical, but not necessarily, like we're looking for like a perfection or anything like that. It's not always going to be, possible, but these are things that we can be more mindful of, the food that we eat and the things that we're doing to kind of prioritize our health about like everything.
So just the simple things that, many of us know that we should do better, like me and drinking less soda.
Oh no, it's all of us. It's all of us. I promise. Yeah.
So what are some of the biggest misconceptions people have about genetics and disease?
Yeah, so many people think that like genetic risk means that something bad is like guaranteed to happen. That's not always true. Genetic information is a tool, so it empowers us to prevent disease. It doesn't necessarily predict a fate. So these are things that we can, like I mentioned early in the podcast, it's something that helps to like help us to make better decisions about our health, whether we need to do a screening now or later on. Things that you can start having a conversation with your healthcare providers or trying to understand your family history. What are things that I might be at risk for? So let's see, like what kind of things should I be looking out for? So I think it's a lot of people think like, oh, something bad's guaranteed to happen, but that's not necessarily true.
Okay. Well, if listeners could do one thing this month to take control of their health, what do you recommend, or what would that thing be?
Yeah, so one thing is to schedule a screening. If you are at the age of, that requires screening, ask a family member, if possible, about health history, write down known conditions, and establish care with the provider, primary care provider. Small steps can make a big difference. So, to emphasize on the screening part, like if you are at the age of screening that's required, please, a lot of the insurances in the United States, at least, they do cover them. Like screenings are, as part of the preventive measures, they are covered and they're usually at free of cost to the patient. So please do have this conversation with your healthcare provider. And if you are up to the screen, please do kind of advocate for yourself to have these screenings done.
Hey, well, thank you for that. So as we try to bring this all to a close and full circle, some of the listeners might, listen to this and be like, well, what's the point? Why does this matter? Like we already know some of this stuff, or
Mhm.
they might feel this isn't going to change much. But in your opinion, why is this so important, and why should we all take this seriously?
Yeah, so mainly, the whole like the topic mainly was about having that prevention. So how prevention can save lives. So when we understand our risk and stay proactive with screening, so we can make informed lifestyle choices. And when we do that, we don't just change outcomes for ourselves, we change the future of our family and community. So having that great quality of life and being there to do the things that you love to do on a daily basis. That's the most important takeaway from this conversation that I can give.
Well, Dr. Maxwell, I would like to thank you so much for speaking on such a powerful topic and having such a informative conversation and giving us so much good knowledge that hopefully we all take with us and go learn something. Go ask Mama what
Mhm.
what did Grandpa have, or go
Yeah.
get screenings. So
Mhm.
we appreciate you on behalf of African Ancestry Link. We thank you so much.
Oh, thank you. Thank you so much for having me. It's such an honor. I'm very grateful for this opportunity to share the message. And especially important if there's a known family history of high risk ancestry. It really helps us to stay informed with planning, early intervention, and the right screening depending on the age and family history. So start that conversation and get the screenings and enjoy the life.
All right. Well, thank you.
Thank you. Thank you so much for having me.